Invia Wound Therapy from Medela Healthcare, the negative pressure wound therapy system from the Name Hospitals Trust. Invia Wound Therapy helps promote the healing of diabetic and neuropathic ulcers, pressure ulcers, chronic wounds, acute wounds, and dehisced wounds. The components for Invia Wound Therapy include low vacuum aspirator, Medela's Invia Vario, disposable or reusable canister, a specialty dressing set which may include non-adherent wound contact layer, antimicrobial gauze, round or flat wound drain, transparent occlusive dressing, barrier skin prep wipes, sterile saline, suction extension tubing set, surgical tape. Wounds can vary in depth and intensity. Please be sure to consult a physician before treatment, as each wound is unique. Prior to applying Invia Wound Therapy, the wound bed should be thoroughly cleaned according to the physician's instructions or the institution's guidelines. Saline is available in select sets from Medela to aid in the irrigation and cleansing of the wound. After the wound bed has been irrigated, the peri-wound area is dried with gauze to provide an optimal environment for the dressings to adhere. The peri-wound area can be prepped with the skin prep wipes provided. Use of the skin prep wipes aids in the adhesion of the transparent dressing and helps to ensure an adequate seal is maintained. Invia Wound Therapy sets include a non-adherent wound contact layer to protect the delicate granulation tissue that forms in the wound healing process. The Invia non-adherent wound contact layer can easily be trimmed to fit the size of the wound. The use of the Invia non-adherent wound contact layer minimizes trauma to the wound during dressing changes and may aid in decreasing the patient's pain. A thin layer of saline-saturated gauze is cut to size and placed in the wound bed. Invia Wound Therapy offers two types of drains, round and flat. In this demonstration, the flat perforated style is shown. When applying the Invia dressing set, the drain is trimmed to fit within the wound bed and is placed to allow for the removal of the wound exudate. Following the placement of the drain, prepare an appropriate amount of gauze and saturate with saline as provided in the Invia dressing sets. The gauze is then fluffed to fill the wound space to skin level. Medela supplies antimicrobial gauze for use with Invia Wound Therapy to prevent bacterial migration throughout the wound and to help maintain the delicate wound environment. The occlusive transparent dressing is applied. By applying the transparent dressing, beginning with the side opposite the drain tubing, an airtight seal can be more easily established. As you approach the drain tubing, slightly lift the tubing at the edge of the dressing and pinch the dressing around the tubing. This process will help create an airtight seal to administer the negative pressure. Firmly press down the dressing around the entire wound after application to ensure there are no air leaks. Invia Wound Therapy dressing sets provide dressing tape to gently affix the drain tubing to the patient. Please consider using a protective barrier where drain tubing comes in contact with fragile or pliable skin. Connect the drain tubing to the suction tubing using the Christmas tree connector. Connect the suction tubing to the canister. Following the application of the Invia dressing set, apply a gentle negative pressure by setting the Medela Invia Vario between 60 and 80 millimeters of mercury with constant suction, as indicated by the red scale on the pressure gauge. Once the Invia Vario has been turned on, the dressing should contract noticeably as it applies the negative pressure to the wound. This application of negative pressure elicits the removal of the wound exudate and mechanically stimulates the wound tissue, promoting wound healing. Contact Medela Customer Service for assistance with product operation or for product availability in your area. 877-MY-INVIA. This product is not available in all countries. Visit www.medela.com to learn more about international distribution.